diphtheria is an acute infectious disease caused by Corynebacterium diphtheria. This Corynebacterium diphtheria is a gram-positive rod. It primarily affects the throat and upper respiratory tract, and it produces a toxin. This toxin causes cells death and therefore leads to the development of grayish membrane on the pharynx. It can cause systemic complications. I will discuss these complications later. Etiology. Causative agent is Corynebacterium diphtheria. It is a gram-positive bacillus and it is non-motile. It produces a toxin. Transmission. It transmits from person to person via respiratory droplets or through direct contact with lesions. Because it transmits through respiratory droplets, it causes infection of the pharynx. It causes infection of the pharynx, form a membrane in the pharynx. The incubation period for its illness is 2 to 5 days. This bacteria colonizes the mucous membranes and releases the diphtheria exotoxin. This diphtheria exotoxin is actually inhibits the protein synthesis by ADP ribosylation of elongation factor 2. And in this way, when there is ADP ribosylation of elongation factor 2, it inhibits the protein synthesis and therefore necrosis of the cells occur. This necrosis of the cells leads to the formation of pseudomembrane. So, when there is inhibition of the protein synthesis, it leads to cell necrosis and pseudomembrane formation. It has systemic absorption. It affects the heart. Toxin has systemic absorption and it affects the heart, leading to myocarditis and cardiomyopathy. It affects the nerves, leading to peripheral neuropathy. It affects the kidneys also. Clinical features. There are local features and there is systemic features. Local features include sore throat, low-grade fever and malaise. On examination, you will see grayish white pseudomembrane that is formed due to necrosis of the cells. It is present on the tonsils, on the pharynx and on the nasal mucosa. On examination, you will also see bull neck lymphadenopathy. Bull neck lymphadenopathy due to bull neck appearance due to lymphadenopathy and edema. Systemic features. Due to toxin production that absorbs systemically also, it can lead to myocarditis, arrhythmias and heart failure. It can also cause neuritis, leading to peripheral neuropathy and also can lead to paralysis. It can involve kidneys and lead to proteinuria, but these two things are very important, and especially myocarditis can lead to death. Diagnosis. When you see a pseudomembrane and a bull neck lymphadenopathy, you have strong clinical suspicion for this Corynebacterium diphtheria. Then you can take throat swabs and can culture on Loeffler's medium or blood agar. And in this way you can recognize the Corynebacterium diphtheria. And ELIC test for toxin production to detect is toxin production, and PCR for tox gene if available, that is responsible for the formation of this exotoxin. How will you treat? You can give antitoxin if it's early. So this antitoxin binds with the diphtheria exotoxin and neutralizes this toxin. So diphtheria antitoxin neutralizes circulating toxin. You can also give antibiotics, erythromycin or penicillin G for 2 weeks. These both are first line antibiotics given for Corynebacterium diphtheria and given for 2 weeks. Erythromycin 500 mg BD for adults, 500 mg BD per oral for 14 days. Supportive care. Because it can cause respiratory obstruction due to the formation of pseudomembrane, so airway management is important, and you should also monitor for myocarditis, especially by doing CKMB and by doing echocardiography, and you should also monitor for any peripheral neuropathy. Isolation of the patient is required until cultures are negative. So you should isolate the patient because it is a transmissible disease through either through direct contact or through droplets.